Hi, Akila. Good evening. Thank you so much for agreeing to take this interview. So can you give us a little bit background about yourself?
Sure. Thank you for having me. And like I said, my name is Akila. I am a family nurse practitioner. I work at Minute Clinic, and I am also an instructor for the USC School of Medicine CRNA program.
Mm-hmm.
And I also teach undergraduate nurses pharmacology.
Well, that's very impressive. Thank you so much. So I have a couple of questions that's regarding the interview that we're gonna do. So the first question is, what do you think the major problems with the U.S. healthcare system today, like from your perspective?
That's a great question.
Mm-hmm.
The main issue that I see is the establishment of health insurance companies, right? Because you have insurance companies and physicians, they work together to essentially keep each other in business, right?
Mm-hmm.
But the problem with that is that you have a whole bunch of other people, right? If insurance is only accessible through a full-time job, right, other people don't have access to those jobs. If they don't have access to a job that offers insurance, they don't have access to health insurance and good health care, right? So to me, that's a significant problem with the healthcare system. The fact that there exists insurance companies in the first place, and that everything we do in healthcare basically is dictated by the insurance company, which is not how it should be, but that's how it is.
Yeah, yeah. I feel the same way. I think it's something that has to be like changing. It's been problematic for quite a while.
Pretty much forever.
Yeah. Okay. Well, let's see. We have another question. So, how effective the Affordable Care Act been in addressing those problems so far?
So the Affordable Care Act, regardless of where you stand politically on that issue, from a healthcare standpoint,
Mm-hmm.
the Affordable Care Act was really beneficial for healthcare providers because there were a lot of people who were able to have access to care. It expanded funding for women's health services, organizations that play a critical role, right? Like Planned Parenthood. It funded those kinds of institutions. And let me see what else. Question again? Sorry.
Oh, how effective has the Affordable Care been in addressing those problems so far?
Right, yeah. So in addition to that, it also provided funding for all of these different Medicaid programs,
Mm-hmm.
which have been pretty successful. I mean, the one in California, Medi-Cal, it's a pretty good program, right? I mean, you can get fairly good insurance with those different plans. So it definitely addressed a very big gap in healthcare,
Mm-hmm.
and trying to cover or bridge the gap, I guess, with those people who don't have access to other kinds of health insurance options.
Sure. Thank you. That's a very good answer. Um, so I have another question that's for the trends. What are the major trends do you see occurring in the healthcare system in the next 5 to 10 years, in your opinion?
Right. Do you mean in terms of like where the system is going?
Yeah, like sure, yeah, yeah.
Where the healthcare system is going in the next
In the
5 to
whole
10 years?
healthcare system, yeah. What could happen? What could happen, or things might not happen the way that everybody wanted to be. It might stay
Right.
the same. Like, what do you think? How do you think about it?
My guess is that even though we want a lot of change to happen,
Mm-hmm.
I doubt we're going to see that change anytime soon. So
Mm-hmm.
many things have to change
Mm-hmm.
that I doubt we're going to see some kind of. I mean, the Affordable Care Act was a significant step forward,
Mm-hmm.
but we were just recently set back
Oh, yeah.
because they changed that. They didn't officially repeal it, but they changed so many things that it's essentially null and void now, right?
Mm-hmm.
So in the next 5 to 10 years, I think we're starting to focus more on outcomes, and it's kind of a catch-22, right? But we are kind of more focused on outcomes now, which is a good thing. But I don't think we're going to see any really significant changes in how healthcare is delivered or accessed in the United States. That would take a lot. It would have to change, and it would have to change over a longer period of time.
Yeah, I see. That's probably unfortunate that nothing major will happen. Well, something might happen, but like in your opinion, it's just not much like big change will just occur.
Yeah,
the
small
next 5
steps,
to
we
10
might not
years.
actually see how that affects things on a large scale. You know what I mean?
Gotcha. So well, with that being said, like there isn't much, things are gonna be changing in the next 5 to 10 years. But like, what changes would you like to see in the system, and how could they be brought about?
Well, I would like to see somebody take down the insurance companies, and I would like to see somebody take down the pharmaceutical industry as well.
Okay.
Because, I mean, health insurance is great when you have it, okay? But there's another side to that, right? If a patient that I'm treating for, let's say, asthma, this is a really good example, a lot of my treatment options are limited based on what the insurance company will cover or not. Right? So then I have to make my plan of care based on what the patient can afford,
Yeah.
even if it's not the best medication choice. And so
Exactly.
we're forced to make those kinds of clinical decisions, and that doesn't happen for any other reason except for the fact that the pharmaceutical companies want to make a lot of money, and they know that somebody with stage 2 or 3 asthma requires inhaled steroids every single day, so they jack the price up to $300-400 for one inhaler.
That's
Which
so
is
sad.
ridiculous. So, pharmaceutical companies are obviously necessary, because otherwise, who's going to make medicine that we
Yeah.
take, right?
Yeah.
So they're necessary, but they drive healthcare a little bit more than I think they should. And then with the insurance companies, it's really the same thing, right? They will tell you what is covered, what is not. If I can order
Exactly.
this, you're right, you can't order an MRI before an X-ray is done, which evidence-based practice, I mean, it's probably what you would do anyways, but you never know. You might have a situation where you know the patient needs an MRI, right? They're not going to cover it. So when we have to make treatment decisions based on that, that's an issue that I have. I would like to see that definitely change.
I think a lot of like physicians have the same problem. They run into the dilemma where they order the best treatment for the patient, or the most affordable care for the patients, or the treatment that's actually covered by the patient, where patient doesn't have to get treated afterwards, and they don't have enough money to pay, or they
Right.
have to go bankrupt to cover the bill.
Exactly.
Yeah. Well, that's sad to see, but that has to go.
Yeah.
Thank you for that. So what do you think? What do you see your role as an MP as in improving health and healthcare in general?
So, in my opinion, the best thing that a single individual provider can do is to focus their practice on health promotion. Obviously, we're going to treat sick people when they come to see us, right? It's what we do. But a nurse practitioner excels in health promotion and keeping people healthy over their entire lifespan. That's the nurse practitioner's expertise, right?
Yeah.
Different from a physician's expertise, which is the diagnosis of disease processes, right?
Yeah.
We do this similar thing. We diagnose and treat illnesses, but our focus and expertise is different. We're focused on health promotion. So
That's good.
I can keep patients, informed about the different screening things that they can do to screen for things like breast cancer, colorectal cancer, cardiovascular disease, high blood pressure, diabetes, all of that stuff, right? I want to keep my patients from getting sick in the first place. I want my patients healthy.
Yeah.
I don't want them sick. Unfortunately, the healthcare system thrives on sick people, right?
Yeah.
That's where it makes most of its money. It's unfortunate, but it's the reality of the situation.
Yeah.
I will try my best to keep my patients focused on health promotion. I want them preventing illnesses rather than having to treat them or catch up with the treatment plan after.
Yeah, that's a very good intake. I mean, that's basically you're telling me you're doing your job like day in, day out. Like
Yes.
hopefully that'll make some like qualitative change in the person's like personal health.
Yeah.
And then possibly like everybody contribute a little bit here and there, and the whole healthcare system might change over time.
Yeah.
Let's just hope for that, right?
Yep. I mean, you have to be a proactive provider. You know what I mean? It's really easy to not offer health promotion opportunities. It's really easy to skip that at a visit, right? But it's also really easy to include it.
Yeah.
So just simply doing it is what should be done. But I guess I'll only speak for myself. I try to offer it for everybody who falls within the recommendations. I'm going to offer them whatever they need, but yeah, health promotion is where it's at.
All right. Well, that's pretty much the question that I have here for this interview, and I wanted to thank you for your time. I really appreciate it.
You are welcome, and thank you so much for having me, Nigel.
All right, thank you.